We have different types of cataracts, and the cataract can be classified depending on which part of the lens. Remember we said it is the crowding of the lens of the eye. So depending on which part of the lens that cataract has affected, that is how we name the cataracts. For example, we have the nuclear cataract. That one affects the middle part of the lens in the front part. So that one affects your vision very fast because it is on the middle. Remember, when light is moving, it hits your black part that you see, then it goes through the other black part that you see, and that is where there is the lens. So if it is on that very part, it is called the nuclear cataract. It affects the center of the lens. Then we have the posterior cataract. Now that one forms behind the lens, and so that one doesn't really affect your vision immediately, and it keeps on growing. Then we have the cataract that is called cortical cataract. This is cataract that forms from the edges. So it starts from the edges of the lens, then coming, sending its threads towards the center. So that one actually takes longer to grow because it comes from the behind of, the edges of the lens. So we also have the congenital. The congenital one is the one that a person is born with, and we have the traumatic cataract. This is a cataract that comes as a result of trauma. Then even a child can get a traumatic cataract because in case the person was involved in a fight, the mother, you never know, you can hit the womb, as in the tummy of a woman who has a child, and you end up even leading to traumatic cataract for the child, not because of a disease that the mother has, but because of the trauma that maybe the mother can get an accident or something. Those ones also can result. But the traumatic one that is very common is when somebody was involved in maybe an accident or maybe in a fight and the eye was hit. That one is the one that we call traumatic cataract. Then we have the secondary cataract. This one comes after you have been operated for the initial cataract. After some years, depending on when the cataract was done, you might find a cataract forming, or depending on a surgery that you were done, then you might find cataract forming. Then we have the welding cataracts. These are cataracts that develop, especially with people who work in welding areas. You have a welding machine, you don't use the protective glasses or the right welding glasses, so you expose your eyes to infrared that eventually affects your lens and then causing the welding cataract. So there are very many types of cataract depending on how they have been formed, which part of the lens they have affected, but all of them, they cause poor or loss of vision. And actually in Uganda, the known leading cause of blindness is cataract. But the good news about the cataract now, this is on management, is that cataract can be managed through surgery. There are different types of surgery, but the one that is most affordable and common is this one that they do a small incision, they remove the old lens and put an artificial lens inside the eye, which allows you to see. And it is one of the most successful. It is cataract surgery, unless you have any other underlying eye condition. It is one of the most successful surgeries in the eye. The person who has cataract will be able to see as they used to see before before they got a cataract. So people should not fear. I am pleased to inform you that there are those other cataract surgeries like the laser surgery, whereby you find that the person is operated and even goes home that very day. Yes, you find that you can go, you do your surgery even at the main hospital, referral. You can go there. They have those machines. At Angel's Eye, we don't do surgery. I don't want to lie to you. We don't do surgeries. We do treat or handle your eyes with glasses. But there is no eyeglasses for cataract. So no, don't be lied by anyone. There's no eyeglasses for cataract, because what we know is that the lens of the eye has become dirty. So you remove that lens or you wipe the dirt. And so the wiping is done through the laser surgery, but the removal is done, the cleaning is done, or the removal is done through the other surgery that has always been done. Because we believe that the lens is clear. It is usually something that is clear here. So if I give, regardless of how much I increase the light from outside, if there is something that is blocking here, you will not see. Like at home, for those, I know most of the .com people will not see this, or they will not understand this. But in in our village homes, we used to have lamps that had a glass, and that glass would form soot around it. It would become dark. For you to have bright light, you used to remove that glass, wipe it clean, and then return it, and then you'd have the bright light. So that is the same case with the lens. So you remove the glass and replace. That is when you do the surgery. But with the laser surgery, you remove those things that have formed, that are formed around those things that are formed around the lens, and then you make sure that the person now can see very well. But even when you have done the cataract surgery, at times you find that you might need to use the glasses because of the changes that happen with the surgery, and there is no harm. So people who are fearing to take their parents for cataract surgery, don't be worried. It is one of the most successful surgeries in eyes. The other thing that you should know is that when you're being done the cataract surgery, they don't kill your whole body. They don't make you sleep. They just anesthetize that part of the eye that is going to be operated. So don't be worried about the cataract surgery. They are the most successful, and your sight is restored, especially for seeing far, just as you are seeing before you got cataract. So there is no medicine for cataract unless the one that has not yet been known to us. So currently in Uganda or in Africa, most of us are using the surgery for cataract treatment. And in Barara, you can get them in Ruharo, in the main hospital, in Dr. Arunga. Those are the ones that are known currently to be doing cataract surgery. Thank you so much.